I am now going to administer my eye and ear drops to my lovely patient right here so he can hear my beautiful voice and see my beautiful face for the rest of the evening. First, I'm going to start by checking my doctor's orders compared to the Cardex and my chart and make sure I have the right eye drops, and it is. He's only getting one drop in the left eye. So I'm going to check his patient's rights. It's the right date, the right time. The eye drops are administered at 1500. I'm going to make sure I have the right patient. Could you state your name?
Kevin Tebow.
And your birth date?
6/8/85.
And that all matches. And the route, which is drops to the eye. And I'm going to check his wristband to make sure I have the right person, and I do. I am then going to don my gloves and look into his left eye, and he does have a little bit of crusts in the inner cannulus here. So I'm going to gently cleanse with my warm water and wash ray. My warm water basin. I'm going to lean his head up. Just from the inner cannulus out, I'm just going to wipe. Alright, then following that, I'm going to take my one dropper and my tissue, and I have my patient sit back with his head slightly hyperextended. Come around to this side. I'm going to pull down on his eyelid just gently so that I can get this into the lower lid. I'm going to do one drop. And have you close your eye and just slightly press on there to make sure that the medicine gets distributed correctly. Alright. Are you having any pain in your eye?
No.
No. Alright. Next, I'm going to do my patient's eardrops. Once again, I'm going to compare the order to the doctor's orders to the Cardex and my chart. And he's going to get one drop to the left ear. Everything matches up. It's all the right medicine. I'm going to check my patient's 5 rights. Drug route, which is drops to the ear. Patient, and you are?
Kevin Tebow.
Okay, and I'm going to compare that with his wristband also. Everything matches. I'm also going to check the time, and this is at 1500. And the amount. Okay. So we're going to be putting drops into Kevin's left ear. First thing I want to do is I want to look into his ear and see if there's any cerumen or anything that's blocking the canal. You just have a little bit, and you don't want to put the Q-tip in, so you don't want to push anything in. So we just do a gentle clean around the outside, and I dispose of this properly in my garbage can. And then we're going to administer the drops. And what I want Kevin to do is to tilt his head up and back here. I'm going to pull on his pinna. I'm going to pull up and back. I'm going to insert 2 drops, half an inch into the ear canal. I'm then going to have him just kind of rest his head here for a few minutes on this pillow so his neck doesn't get too sore. And just, he's going to stay like that for about 5 to 10 minutes or 15 minutes. He could be laying down also and laying his head on the side of the pillow, but I didn't have room in my living room today. Oh, 15 minutes has passed. I'm going to stick this cotton in his ear to catch any dripping, and but I'm not going to shove it into the ear canal. It's just going to sit in the outer portion of his ear. And that's the procedure. All right, and then for a quick synapse on the meter dose inhaler, I'm going to check my patient's 5 rates. I'm going to check the order with the MARS, the Cardex, and my doctor's orders. I'm then going to make sure that I have the right drug, Dr. Pat, my 5 rates. I'm going to explain to the patient to breathe out deeply and then immediately take a forceful intake. And he's going to want to hold it in for at least 10 seconds and then exhale through pursed lips. When you do an inhaler, you want to check, make sure you assess your patient's lung sounds and other vital signs if needed per drug recommendation. You do that based on doctor's notes. And then for the transdermal patch, you want to apply it to an area with good circulation. So back, shoulder, arm, a place with few hair. You want to remove the hair before the patch is applied. And when you do apply the patch, you want to make sure that you're wearing gloves because you don't want to get any of the drug on your person. You want to make sure that the area is clean and free from debris. And when you do have the patch applied, you want to sign with the person. You want to date it and put the date and time that the patch was applied. Then immediately after, same with after the ears, eyes, and the inhaler and the dermal patch, I want to make sure I go back right away and sign off on the patient's chart that I completed all the procedures and that all the drugs were administered. And that should conclude my synapse and procedures.